So I'm Meredith Stawicki. I'm one of the advanced medium-term trainees and a speech therapist here at UC Davis. And I did my project working with Dr. Thompson on pediatric feeding disorders, identifying common themes regarding barriers to intervention. So for the background of this study, children with ASD and NDD have a higher rate of feeding disorders and challenges than typically developing children, with an estimated prevalence of feeding difficulties in children with ASD as high as 90%. Other studies have estimated 58 to 67% of parents of children with ASD reporting their child as a selective or picky eater. So knowing that, we wanted to go and look into the parents' perspective on their perceived barriers to intervention and ideas of feeding therapy, and the perspective of being a caregiver to a child with feeding disorder. So the goals of this study were to investigate barriers experienced by families of children with feeding difficulties, to identify common themes among this population, and to better inform clinical practice to improve provision of services through quality improvement of standard practices, improve evidence-based care, and guide future research within this population. So the procedure of this study that was eventually modified due to the COVID-19 pandemic was that the participant completed surveys and participated in a focus group to explore potential barriers to feeding intervention and common trends among children with feeding problems. The survey that the participant completed took approximately 30 to 45 minutes, and the focus group lasted between 30 to 60 minutes. The focus group was completed via Zoom and audio recorded and transcribed for later analysis. Surveys were mailed to the participant and returned to myself. I scored and analyzed them for the presence of themes. For the inclusion criteria of this study, we asked for participants that were caregivers of a child with feeding challenges who had been seen in the past year or were currently seen by myself at the feeding clinic or the PM&R clinic here at UC Davis. They had to have a child under the age of 7 with a developmental disorder or ASD diagnosis with no known swallowing problem, because we wanted to rule out pharyngeal dysphagia as any potential complication in this study, and have English as a primary language. Caregivers were mailed a letter as identified by myself, looking through who fit the inclusion criteria, and we were able to identify one participant before the COVID-19 IRB restrictions were in place. The parent questionnaires that were sent to the participant were the feeding clinic intake questionnaire, which was able to provide us with background information and early feeding history and family history, as well as some background on the family and the child. The feeding impact questionnaire, the family management of feeding disorders, the pediatric quality of life inventory parent report, and the pediatric eating assessment tool, all of which are parent report measures looking at quality of life, feeding patterns, and the impact of a feeding disorder on the child and the caregiver and the dynamic within the family. The results of this, when we looked at characteristics of the participant's child and background information taken from both the intake and focus group questions, was that the child had a diagnosis of ASD as well as sensory processing disorder. With early feeding, we were seeing that there was many indications that this child had difficulty transitioning to solids and did not accept puree and baby foods. The current diet of the child was restricted to mostly crunchy foods and liquids. This child accepts less than 20 foods and has maladaptive mealtime behaviors. Another trend we saw within the intake form and background questionnaires, as well as focus group questions, was that this child had context-dependent feeding behaviors, meaning that they were more open to try new foods with the feeding therapist or would eat different foods at school or in different contexts. Other characteristics of the participant's child was that they had a long evaluation and treatment history since the age of 22 months. They had seen many speech therapists and occupational therapists, were followed by a GI doctor. They were followed by many dietitians, had seen feeding therapists both through the regional center, Easter Seals, as well as here. They were followed by an audiologist, an allergist, and an ABA therapist, several. So from the parent report measures, we identified some of the following themes: the overall feeling of feeling concerned for not meeting the child's needs for nutritional intake, the feeling that it was a time-consuming, emotional, and frustrating process, the feeling that others didn't understand the complexity of the feeding difficulties that their child experienced, The high importance of feeding difficulties and the impact on family was highlighted as a theme throughout all of the questionnaires and focus group questions. Identifying challenges with social and emotional functioning in the child, as well as identifying feeding behaviors such as restricted variety and rigidity in meal times, gagging with meals, and frequent meltdowns. So for the focus group, we conducted structured interviews with myself and Dr. Thompson. We obtained consent, we ensured confidentiality, audio recorded these focus groups, transcribed them into a Word document, and analyzed them for the presence of themes. One of the questions asked the caregiver to describe their experience in obtaining feeding services for their child. They reflected that it took several months to obtain services. They weren't able to receive these services for feeding intervention through the school. And after evaluations for feeding in several different locations, they were told that the child's feeding difficulties were too difficult for them and they were not able to take and provide services for him due to the severity of his feeding difficulties. She reflects that it was a process that she needed to keep fighting and pushing for, and also reflects there were many insurance difficulties that prevented timely intervention. When asked to describe the barriers to receiving care for her child, she reflects that she's a very strong advocate, as her background is in education, but acknowledges that her background's not in health or insurance, so it took a lot of extra effort and not taking no for an answer. A long process of waiting for new referrals. And she also noted that a lot of her friends or other individuals that she knew that had children with ASD or neurodevelopmental disorders had given up on the process, as it was time-consuming, frustrating, and emotional. When asked to describe stressors that she'd experienced having a child with feeding challenges, she describes family meal times as a near impossibility for the child to sit at the table, frequent gagging and adverse reactions to the food presented, having a very limited variety of foods accepted, and then having additional concerns with the child's allergies and nutrition not being able to meet the child's nutritional needs, and the behaviors at meal times and needing to have techniques to manage that behavior. When asked about resource, insurance, or financial barriers, she reflected that she feels the quality of availability of services is impacted by her insurance, feeling that she's stuck with what she can get, and also noting that the child requires a special diet, which can be expensive and not feasible for a child who has a restricted intake and won't accept the foods that are offered or provided by insurance, as insurance will only cover certain supplements and formulas that maybe the child won't take to. When asked to describe her support system for her child's feeding challenges, she describes that she previously received through the feeding clinic, as well as ABA. Her family has been in giant support in providing additional carryover for her child's feeding challenges and school support, but notes that given the COVID-19 pandemic, they've lost ABA, speech, special day classes, and feels that she's lost everything that she worked hard for the child to obtain. When asked for some suggestions or changes she would make to her child's journey to feeding intervention, she says the most important thing that she would want to implement is having the financial ability to find and acquire the intervention of experts in the field. And when asked one way or change she'd want to suggest to others working with their child, whether that's a specialist or a family member, she would always encourage them not to pressure the child to eat and to have special foods and options available to ensure that the child had adequate nutritional intake. When asked if there was anything else she'd like to share about her experience being a caregiver to a child with feeding challenges, she notes that she's always concerned about meeting her child's needs and acknowledges it's a very hard road that most people don't understand. It brings a lot of emotions and frustration and heartache for the child and the family that's not easily remedied. She says, it's going to take years and years and years, reflecting that it's going to be a long process. When we're looking at barriers and limitations to the study, the COVID-19 pandemic with the institutional changes and IRB protocols, due to the COVID-19 pandemic, there were no in-person visits and decreased enrollment. Additionally, the interpretation of structured focus group questions was limited to those listed and approved by the IRB, so we were not able to expand due to the nature of the design. We weren't able to ask follow-up questions on future directions of the study would be to carry out this study with a larger participant population, also using semi-structured interview style rather than structured, so we could unpack and ask follow-up questions. We'd also like to do in-person focus groups to facilitate conversation among the caregivers to reflect on their experience and to analyze and identify across a larger sample size. I'd like to thank the LEN faculty, especially Heather Thompson, Dr. Hung, Dr. Stummer, for all of their help with this project, and a special thanks to the participant who enrolled in this study and contributed her time, insight, and experience as a caregiver.